Good morning. My name is Dr. Lily. I'm going to be conducting your cranial nerve exam today. I don't see that you have any actual complaints or worries about your cranial nerves. This is just a standard preventative care thing. Cool. Well, cranial nerve exams are an absolute litany of tests, so let's get right into it. I would like to start by just taking your pulse, your blood pressure. Doctor's got to do it. So we'll start with your heart. Okay. If you could just take a big breath in for me. And a big breath out. Okay, big breath in. And a big breath out. Going behind you. I don't know why I do it too. It's like to encourage them and to encourage the patients. Big breath in. And a big breath out. See, I didn't do it that time. Keep breathing like that for me, please. Thank you. Just listening to your lungs now. And everything. Sounds good. Take your temperature real quick. With our ancient thermometer. Really hope we get one of the better ones. Yeah, we're in the bad room right now. Well, not bad, the old room. It's got all the old equipment. Under your tongue, thank you. And now we wait for half a century because this thing takes for freaking ever to get up to temp. Oh no. No, I'm glad to see it, honestly. People don't get their cranial nerves checked very often, and an ounce of prevention is worth a pound of cure, right? Excellent. 98.5. Well, according to your chart, that's a little lower than you usually run, but it doesn't mean anything, really. All right, my dear. Arm out. Do you have a preference, left or right? Yep, one of the old ones of these too. Okay. Yeah. I'm good at it. Been using them for decades, it feels like. Okay. Oh yeah, we gotta spin that. There we go. Well, you've had a healthy blood pressure before. So we gotta take it every time. Every time. Alright, that's all the boring stuff out of the way. Let's go ahead and start with your eyes. That's what I always like to start with. And we always go for classic Snellen eye chart. I'm just going to stand here and take my fabulous laser pointer. Tell me what this letter is. Oh, I'd be worried if you couldn't tell me. It's always an E. I don't know why. Okay, we'll go down to right here. Give me this one. Just go across the row for me and tell me what you see. Okay, great. Next row down. Okay. How about the row under that? Here, I'll take that off so you can just read across the board for me, okay? Okay. What about this row? Okay, could you tell me this one again? Okay, what about that one? Okay, can you read this row for me? All the way left to right. Third one again. Okay, and this one? Excellent, okay. Do you normally wear glasses? Okay, cool. Oh, I can't tell. I like to do one up close too, so I'm gonna get right up in your face. This helps out with nearsightedness. Okay. Oh, I need to actually see what I'm looking at here. Okay, start with this one. Okay. Okay. How about this one? Yeah, just all the way across the row like that. Keep reading for me. This one. Okay. Okay, what about this last tiny river down here? Okay. This one? Yeah. This one? How about that one? That one? What about this one? Perfect. Very, very good. Okay. And if that wasn't personal enough, I'm going to get up in your face with this. First thing I do, we have you follow the light. Okay, we're going to do a couple different light tests. This one, I just want you to keep your eyes, both of them, on this light. Starting off slow. Okay. Because sometimes I get entranced by it myself. I'm supposed to be watching your eyes. Okay. Just gonna hold your head and come in just a little bit. Sorry. Watching your, there you go, watching your pupils. Okay, we're gonna go fast. Follow. We're just watching your fast twitch reflexes of your eyes here. Sometimes I just like to make your eyes do weird things. Okay, very good. Now you're going to look at my nose, okay? Don't look at the light. Don't look at it at all. Just stare at my nose. Okay, well, sorry. I'll try to keep it out of my nose way. Okay. Keep looking at my nose. Very good. Now, we're leveling up the challenge. Follow my finger. Don't look at the light. Follow my finger. Okay. If you could tell me when you see my finger come into your peripheral vision, okay? Don't move your head. Probably shouldn't make the sound now that I think about it. Okay, tell me how many fingers I'm holding up, okay? You can count the thumb. I just keep doing 2 and 5. That makes it easy, yeah? going to do two slightly unpleasant things. I'm sorry if they bother you. They'll be very fast. Keep your eye open for me. I'm going to very, very gently touch your eye with this, okay? Do your very best not to blink. We're going to do both sides. There you go. See, not so bad. There you go. Now I'm going to blow in them just a tiny bit. Ready? Okay. It's okay if you blink a little bit. I will have to do it over again though. Okay. We've got one more eye test. And we'll move on to your ears. If you could look at the more perfect circle one, not at this one. Don't look at this one at all. You don't even know it exists. Okay? This one, not this one. I'm just going to be watching your eyes following it. Oh, maybe I don't need to use them. Okay. Doing great. Very good. Okay, finally moving on to ears. Let me get just a quick look inside your ears because I want to make sure that your hair is not going to be impaired by anything. So I'm just going to go in with an otoscope, okay? Feel a little bit of pressure. And I'm just going to take a look at what's going on in there. Looks pretty clear. I don't see any perforations. That's not part of the cranial nerve, like if you're having hearing problems because of a perforation, well, yeah. Okay. Looks healthy. And sorry about that. Looks good. No perforations, no inflammation. Ear looks very, very healthy inside. Which means we can proceed with the tests. What I'm going to do is I'm just going to make a very light sound on either side of your head. Okay? It'd be best if you closed your eyes. I would ask you to do that. I need you to tell me when you hear the sound at all, okay? And when the sound becomes loud. Now I know this is a subjective term, but loud to you, okay? Okay. Well, how about not loud? How about fairly audible? Okay. Mm-hmm. Okay. Okay. Okay, repeat the word that I say. Oh. Okay. Repeat the word that I say back to me, please. Elephant. Gymnast. Trepidation. Okay. Geography. Okay. Lantana. Banjo. Leather. Bubble. Nintendo. Coral reef. Espresso. Trench coat. Cerulean. Very good. Okay, we've got one more hearing test. This will be similar to the light sound I was making, okay? It's actually two more, sorry about that. I'm going to be moving this around your head. I want you to tell me left or right when you're hearing it more in your left or your right. Okay. Keep your eyes closed. Okay. Okay. Yep. Perfect. Yep. Look, when you've only got two options, it's hard to mix it up. Okay. 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 You're doing very well. You're not being graded, okay? Well, not a letter grade at least. Okay, last test. I'm going to very, very gently touch parts of your ears with this, okay? All you have to do is tell me when, not where. Okay. 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 Very good. Okay, so next we've got our smells. For your nose, we pretty much only do a couple things. It's mostly to see if you can smell things. Surprise. Oh, 5, okay. It doesn't smell like anything. They're really old, and we use essential oils essentially on these like beads for them. So I'm hoping that if I give it a little shake, it's gonna get the smell back. Yeah, well, like I said, in the old office. Oh, I lost a couple beads. Ooh, it smells good though. Okay, you ready? I'm gonna pass by your nose twice, and then you're gonna guess. Once, big whiff in, big whiff in. I promise it's not gross. Very good. This is the only one that we use natural stuff for. Okay, I'm assuming that we've got the same problem with this. We don't have the essential oils anymore. That's the problem. Or I would. You're telling me. There we go. There we go. Passing by, big old whiff. And your final answer? Good, good. Okay, this next one's a liquid, so I'm hoping it's not going to be having the same problem as the other ones. Let's look at that. I don't know why we have it in a dropper bottle. Are you ready? Going by. One more time. Oh yeah, good job. And last one. This one we have in a spray bottle. I apologize. I promise it smells good. I'm gonna spray it here and just lean in. Take a big whiff. It's old too. Oh, that's nice, huh? Yep. Great job. Seems your sniffer is doing fine. Okay. Now we're going to do a little uncomfortable stuff. Tongue depressor. I'm going to depress your tongue. Like physically, not emotionally. Alright, I'm going to push down on your tongue. Okay, and I want you to push against it. We're going to be doing a lot of that with all the muscles in your body, where I'm essentially going to be putting pressure, and I just want you to counteract that pressure in equal measure. Okay, don't shove me with your tongue or something. Okay, pushing down. Good. I'm going to go in under your tongue and press down on it. Or I'm pressing up. Okay, very good. I'm going to try to open up big for me. There you go. I'm going to press this side, push against it. Very good. Other side. Very good. Okay. Open really wide for me for a second. Okay. Throat looks healthy. Tonsils. You have huge tonsils. I won't take them out anymore, which is probably for the best. Okay, mouth looks very healthy. Okay, now we're going to be doing the pressure tests. I'm going to start by gently tapping places on your face, okay? You're going to need to close your eyes. I want you to tell me where on your face you feel the taps. I promise it's going to be really light. It sounds like it's going to be kind of loud. It's not. So, eyes closed. Thank you. Just tell me what part of your face you feel it on. Very good. Okay. Very good. I know it looks scary. This is the sharp soft test. Same thing. I'm going to, and you need to close your eyes. No cheating. I'm going to gently, very, very gently touch your face with either a sharp object or a soft object. Okay? Just say sharp or soft. Yeah, it won't hurt at all, I promise. Eyes closed. Okay, very good. I know it's busy out there today. Okay. No peeking. Sharp. See, I told you it didn't hurt. Mm-hmm. Very good. Good. Sharp. Hey, 4 times in a row is good. Just keeping you on your toes. Oh, that's a good point. I am right-handed. Would you feel safer if I switched? There you go. There you go. Just gonna get right back here on your neck. Just checking all of your nerves. Make sure that you can feel. There you go. Perfect. Very well done. All right. Like I was saying earlier, pressure tests. I'm going to use my hands to gently press against parts of your body, like your shoulder. We'll start with your shoulder, and I just want you to lean into my pressure in equal measure. Like I said, don't try and pull me over, okay? Now, I've had a patient do that before. I pressed on their shoulder, and they pretty much just like freaking shoulder checked me. Okay. Gently pressing. Good. Then I'm going to pull like towards myself, and you want to put pressure. Okay, very good. Okay. Other side. And pulling toward me. Very good. Lift up your arms for me. Yes, and we'll start like this, okay? And then very good. Pressing against your hand. Good. Going behind your hand and pressing back. Good. Now at your shoulder. And the elbow. You're doing great. Okay, other side. Giving you the slowest high five ever. And behind. With the shoulder. Good, good. There's kind of a rhythm to it. Very good. Arms straight out. There you go. Yep, push up. Good. Push down. Good. Down. Up. Very good. Arms at your side now, please. I'm going to try and tilt your head. Please resist me. Okay. Good. Behind. Yeah, against. Sorry, that's an awkward position here. Let me. There we go. Very good. Okay, we're gonna get into the nitty-gritty of your face. Closing your jaw. Press against me. Open your mouth. There you go. I'm going to put 2 fingers inside your mouth. Don't bite me, but push against. Yeah, you understand. You understand. There you go. I'm going to push on your cheeks, okay? And I want you to puff out. Okay. Okay, now puff out your cheeks with a lot of air. I'm going to push on them. Don't let me blow the air out, okay? There we go. Very good. Push. Perfect. Okay, let me write a couple things down. I did not notice any problems with any of your nerves today. We had a couple misfires on your soft, sharp thing, but that's normal with how many places I did. And we have a lot of nerves in parts of our face, but as I was doing the neck area, it's a little harder to tell. If you find that you're worried about them, you can always come back and we'll do more rigorous tests. These are just prevention, right? Just checking to see if we're noticing any problems. Your eyesight was great. You do go to the optometrist every, yeah, totally fine there. Okay, I would suggest 3 years maybe, but anytime you want, you can come back in. Absolutely. It was super good to meet you. You have a really good one.